Bupropion is a medication that is used to treat depression and related mood disorders. It increases the levels of dopamine and norepinephrine in the synapse to mediate their effects. In this mnemonic video, I'll share my visual way to remember Bupropion, its mechanism of action, clinical indications, and side effects. I just got word that 2 climbers were lost in the snowy mountains. Now I'm here trying to look for these stranded climbers in this crazy amount of snow. Wait a second, I found some boot prints in the snow. Maybe the climbers were headed in this direction? Well, let these boot prints remind us of Bupropion. Get it? Because boot prints sounds like Bupropion. It's the Bupropion boot prints. Even though I'm a ski patrol rescue member, even I can still get lost in these mountains sometimes. It's a good thing I've got my handy compass with me. Like any compass, this one's got a constant arrow pointing north. By the way, the north-pointing compass here should remind us of norepinephrine. Get it? Because north sounds like norepinephrine? This is to help you remember that Bupropion increases norepinephrine signaling in the brain. The way it does this is by inhibiting the reuptake of norepinephrine from the synaptic cleft. This increases the amount of norepinephrine in the synapse available to bind to postsynaptic receptors, increasing the overall activity of norepinephrine. The mechanism here is still being studied, but it's thought that increased signaling by norepinephrine has mood-altering effects that contributes to Bupropion's function. Let's move on to cover the other major neurotransmitter involved. Like any rescue expedition in the mountains, you've got to come prepared with a bunch of rope, right? Yep, take a look at that rappel rope. By the way, this rope should remind us of dopamine. You know, since rope is our recurring symbol for dopamine, or ropamine. Bupropion also works to increase dopamine signaling in the brain. It does this similarly to norepinephrine, by blocking reuptake of dopamine from the synaptic cleft. Since dopamine is a powerful neurotransmitter involved in the reward system of the brain, it should make sense that increasing dopamine can also work to treat psychiatric disorders. On that note, let's cover some of the clinical uses of Bupropion, shall we? Oh man, we finally found the stranded climbers. And just in time, too. Looks like one of them almost gave up and broke down, thinking he wouldn't be rescued. You can even see him crying in sadness in the distance. By the way, this sad, crying climber should remind us of depression. You know, since the guy definitely looks pretty depressed right now. Bupropion is used to treat depression, formerly known as major depressive disorder. How does it work here? Well, that part's still under research as well, but it's thought that depression can occur due to decreased levels of neurotransmitters like norepinephrine and dopamine. As we've already covered, Bupropion increases the signaling of dopamine and norepinephrine in the brain. It should follow that this can be helpful to treat depression. It's worth noting that Bupropion is used second line after agents like SSRIs or SNRIs, as it's not quite as effective as those agents in treating depression. However, Bupropion is pretty commonly used, in part due to its favorable side effect profile. But before we go there, let's briefly talk about another clinical use case for Bupropion. Looks like our sad, stranded climber was relieving his nerves by smoking the cigarette. Upon seeing the rescue team, he was so surprised that he dropped his cigarette. By the way, let this dropped cigarette remind us of smoking cessation. Bupropion is prescribed to help patients quit smoking. It makes cessation easier by reducing the withdrawal symptoms in patients who smoke. The mechanism of action here is not well defined, but it's thought that modulating the dopamine reward pathways by Bupropion can help make quitting smoking easier. Dropped cigarette for smoking cessation. That should be pretty easy to remember, right? The stranded climbers here have clearly not been eating well here on the mountain. Look how skinny they are. No wonder why they're shivering. The skinny, stranded climbers here should remind us of anorexia or bulimia. Get it? Because these patients are often dangerously underweight. And these skinny climbers are shaking or shivering to help you remember seizures. Since seizures are disorders of rhythmic shaking, right? This is to help you remember that Bupropion can cause seizures in anorexic or bulimic patients and is therefore contraindicated in these patient populations. This wasn't just any rescue mission. One of the climbers is actually married to a member of our ski patrol rescue team, as we see him kissing his spouse on the cheek. This successful reunion kissing should help us remember that Bupropion doesn't cause any sexual side effects. Got that? This is in contrast to other antidepressants like SSRIs and SNRIs, which can both cause impotence, anorgasmia, and low libido. Many of the patients who suffer sexual side effects on other antidepressants are switched to bupropion for this reason. Make sense? It's been a while since our ski patrol leader and his wife have seen each other, and she's showing him just how much weight she's lost during her time stranded in the mountains. Just take a look at how loose her pants are fitting. This is here to help you remember that bupropion causes weight loss. This is another way I remember that these drugs should not be used in anorexic or bulimic patients, since the drug itself promotes further weight loss. Note the stark contrast against other antidepressants like SSRIs and mirtazapine, which cause weight gain instead of weight loss. Bupropion is rather special in this regard, so if you see a depressed patient who is suffering comorbidities from obesity, then bupropion might be the drug of choice. Finally, before we close, there are just a few other nonspecific side effects of bupropion that we should mention. Bupropion can cause tachycardia, insomnia, and headaches. I like to remember these side effects as things that can all happen with increased levels of catecholamines, specifically norepinephrine. Note that tachycardia, insomnia, and headache are rather nonspecific, meaning that they will almost never help you pick bupropion from other drugs on test day. As such, these are low yield and I would not spend time memorizing them, but we've just included them briefly here for completeness, okay? Pretty good day rescuing folks out here on the slopes, huh? We've just got called to return to base, so let's wrap up real quick and get out of here. Bupropion is a medication used to treat depression and promote smoking cessation. It is a dopamine and norepinephrine reuptake inhibitor working to increase the signaling of both neurotransmitters in the brain. It's important to know that bupropion is contraindicated in patients with bulimia and anorexia nervosa, as it can cause seizures in these patients. In contrast to other antidepressants, bupropion promotes weight loss and does not have any sexual side effects. Finally, bupropion can also cause nonspecific side effects like tachycardia, insomnia, and headaches. Alright, and with that, we're done with bupropion. Mission accomplished. I'll catch up with you guys in the next one.